Hey everybody, so I chose to talk a little bit about the reverse total shoulder today. I've seen a couple of these and I think that they are super cool. So I wanted to elaborate a little bit more on not only the similarities, but the differences for not only the reverse total shoulder, but how it relates to the total shoulder arthroplasty operation as a whole. Also the differences procedurally in both these operations, what patients are eligible for these operations based on how they're doing clinically speaking, as well as the post-operative indications of both these procedures as well. So it is important to note that while both these procedures are very similar, the goal of both these procedures is going to be to reduce not only glenoid but humeral arthritis. But you're also going to want to increase, the goal of this procedure is also going to be to help increase that pain-free range of motion of that shoulder joint, as well as increase strength to protect that shoulder joint as well. The total shoulder arthroplasty is going to be best suited for patients with functioning rotator cuff muscles. The reverse total shoulder is going to be best suited for patients who do not have those functioning rotator cuff muscles, but they also could potentially be having complex fractures of the shoulder capsule. You may also see a reverse total shoulder to even correct a previous failed total shoulder arthroplasty. So that's where the differences in some of these procedures may lie. And that's where they get kind of cool to figure out what's best for your patient as well. So the reverse total shoulder is actually going to invert the normal biomechanics of the shoulder. Instead of your traditional ball and socket alignment, an implant will be put in the glenoid that will make the glenoid convex and the head of the articulating portion of the humerus concave. By changing the convexities, you'll get a bit of a medial shift in the placement of the shoulder joint relative to the surrounding musculature. So this will actually elongate the deltoid, making it more efficient, and it will become the primary mover of the arm. And this is going to help allow for greater elevation of the humerus as well. All right, so now that we've gone over a little bit about the procedure as a whole, the post-operative implications of this procedure is actually going to be that you're going to be immobilized for 4 to 6 weeks, and then after 4 to 6 weeks, you're going to be limited to no extension, no internal rotation, and no adduction of the arm for up to 12 weeks. You're also not going to be able to do any weight bearing. So as a clinician, you're going to want to be following the protocol from the surgeon extremely closely and keeping them in the loop. So you don't want to be performing extension, adduction, or internal rotation within those first 12 weeks because that could contribute for the prosthesis dislocating not only anteriorly but inferiorly as well. And so with that, some of the activity impairments that you're going to have with the lack of those movements is going to be, it's going to be pretty difficult to reach behind you and also to tuck in a shirt as well. So we're going to go over some modifications for how you can not only put something in your back pocket while you've got this procedure going on and you're healing from that, as well as So with our post-operative precautions for the reverse total shoulder, you're not going to be able to do extension of the arm, let alone internal rotation or abduction of the arm. So putting something in your back pocket is going to be a complete no-no with this arm. So if you absolutely have to, if you're tucking in a shirt, you wouldn't be able to reach behind you on that ipsilateral side. So you may actually have to go contralaterally and go the opposite direction. Keeping that arm in that sling, you may have to tuck in your shirt around the back side of your pants and then reach around to complete that circle. Because then once you get to the front side, you'd be able to complete tucking in your shirt and adjust it to your liking. You just won't be able to reach that side the affected shoulder is on.